May is Stroke Awareness Month. Statistics show someone has a stroke every 40 seconds and every 4 minutes someone dies from stroke in the U.S. Joining us for this Mindful Monday chat is Bethany Gertler, manager of Gundersen Health System's stroke program. Good morning, Bethany.
Good morning.
Thanks for being here. So yeah, let's just start. Tell us, how common are strokes?
So like you mentioned, somebody has a stroke every 4 minutes. They are very common. There's about 800,000 people that have a stroke each year. And a stroke happens when there is essentially a change of blood flow to our brain, either a blockage, preventing it from getting there, or a vessel that bursts.
Okay, and then Gundersen is a stroke center. So what can you tell us about that?
Yeah, absolutely. So there are different accreditations, and Gundersen is accredited by the Joint Commission. And essentially being a stroke center means that we look at the research and the evidence that's out there and make sure that we apply it to our program to make sure we're offering the best care for our patients.
Okay, and it is the only accredited stroke center in our area, is that correct?
It is the only stroke center in our area that provides endovascular or clot retrieval, and coiling of aneurysms, but both of our facilities are accredited stroke centers.
Okay, and so why is having something like this, so important in our community?
It's huge because we can offer high quality care to our patients very quickly. It means that our staff are trained, so if we hear that a patient is coming in with a stroke or arrives with symptoms of a stroke, we can all act very quickly because everyone has the high level of education and those processes in place to treat our patients.
And what are some signs of stroke people should know?
So stroke symptoms come on very suddenly.
Okay.
It can be anything from a facial droop to a weakness on one side of the body, numbness or tingling on one side of the body. And the biggest thing with stroke is that they can look different in everybody. So someone can have just one minor symptom versus somebody else can have a very obvious symptoms of weakness on one side, maybe not being able to speak with you. So severity can change drastically between each individual.
Okay, and there's an acronym that people can remember, right, to remember some of these signs. Tell us about that.
Yeah, absolutely. So Be Fast is the acronym that we like to use. It reminds you the obvious to be fast. So if you do identify these symptoms in yourself or someone else, act quickly and call 911. But what those symptoms stand for is the B and the E are looking for changes in balance, and then E stands for eyes, so changes in vision, either not being able to see or double vision.
Okay.
And then the FAST, the F stands for face, so facial droop on one side. A stands for arms, signifying weakness on one side of the body. S, changes in speech, either slurred speech, not being able to talk normally, and T is for terrible headache and the reminder that time is essential.
Okay, and it's not every single one of these that you have to be experiencing, right? Even just one, what should you do if you're experiencing any of these?
So if you're experiencing any of these or identify them in anybody, calling 911 is the best thing to do. Care for you will then start before you arrive to the hospital versus having a family member drive you. Then care doesn't start until you arrive at the hospital. So calling 911 regardless of the severity of the symptoms.
Okay, so be fast, very important there. All right, anything people can do to prevent strokes?
Yeah, absolutely. Really what we do when we go to our primary care provider is they look at kind of the basics. Are you a smoker? Do you have diabetes? Do you have high cholesterol? All of those are really big factors in stroke and stroke prevention. So looking at those things, if you're a smoker, stop. Controlling diabetes if you have it. High blood pressure is a really big one, especially in our area. So if you do, controlling it. So a lot of the risk factors for stroke, there's something that we're able to do to kind of counteract those and help prevent and reduce your risk of having a stroke.
Okay, all right, Bethany, well, thanks so much for being here to share your expertise with us.
Yeah, thank you so much for having me.